Hi, everybody. My name is David McManus, and I'm the editor-in-chief of the Cardiovascular Digital Health Journal. And I'm really pleased to be joined today by former FDA commissioner and current lead for policy at Google Verily, Dr. Robert Califf, a real luminary in the field of digital cardiology and digital health in general. Thank you for joining me, Dr. Califf.
Dave, it's great to be with you. I look forward to the conversation.
All right. So listen, I've always wanted to ask you this question, and now I get the opportunity to do it in front of a camera. So, as a digital health researcher, I've had the Kool-Aid. I've drunk the Kool-Aid, and I see real opportunity for digital health technology to change how we're doing research and how we're identifying and treating cardiac conditions. In your perspective, how is digital health technology changing the way we do first research in the cardiology space?
I'd say that there's a real parallelism between the research effort and the clinical effort, which is good because they really should be combined. Some of what I'll say all day today is really an old theme, at least for me, which is that clinical care and at least clinical research ought to be essentially the same thing. And digital technology essentially can make things more efficient and more comprehensive. But it also has the risk that it can exacerbate problems that we already had. In other words, if you take a bad system and make it more efficient, you've just made it even more damaging to people.
Well, Dr. Califf, I have a follow-up question for you because you raise a follow-up question, which is, okay, you've got this great digital health technology that can now generate high-quality data to measure all sorts of new things. Do you see it right now as much a challenge to the health system to rise to incorporate this information and adapt to this new data stream and the desire that patients have to be connected, given the limitations to our clinical practice and the paradigm of the once-a-year visit?
Well, Dave, no offense intended, but let's get oriented here. We're in the United States, which means when you say the health system, I don't know what you're talking about because we have probably the most fragmented approach to healthcare anywhere in the world, and we're paying a price for it in several ways right now that I'm sure we'll get into later. And because of the way our financial incentives work, at least up until the COVID-19 pandemic, my major concern was that the organized health system would block it because digital health doesn't fit in with the way the payment system works. And it doesn't matter how good your technology is or how useful it may be, if it detracts from the way people get paid. And in this case, I really mean that. It's not just do they not get paid for it, but in using it, do they actually potentially reduce the amount of money they get? You got a real problem with deployment. I do think the pandemic has shown us how much better parts of it can be. So, and particularly in clinical research, where we'll get into the issue of regulation, I think, in another segment. But things are opened up. We can see it. Now let's see what we can do with it.
So, Dr. Califf, one of the things that we were discussing earlier was the fact that transition or adoption of virtual medicine visits by cardiologists has really opened the door towards sensor data and other types of digital health technology being integrated into practice. What do you see right now as the areas where new information might be incorporated into the clinical care encounter?
I think it's fair to say that the first step was just getting digital clinic visits in motion that involve talking like we're doing today. And that's turned out to be highly valuable. A lot of people love those visits, and I'm sure they'll be instantiated into everyday practice. But now that we have that pathway, it should be relatively straightforward to now begin to engage devices and with sensors and other kinds of digital uptake that can now be streamed right into the system. If we think about the normal things that we want to know about health, You know, you've got blood pressure, heart rate, heart rhythm, temperature, cognition, mood, all these things, a gait, all these things can be measured now using digital technology. They can be relatively continuous. But we've got a lot of work to do to actually understand when the digital information adds something, when it's useful, and also to make it so it's unobtrusive. I mean, one really big lesson is that if people have to do almost anything to connect to something, you're going to lose probably the people you most want to help in that process. So developing the technology so that it's just not even noticed that it's there, I think will be a big part of this. And then finally, dealing with the data is going to be a real challenge.
Yeah.
Missing this artifact and all that.
Well, thank you, Dr. Califf. So stick around, folks. We're going to have another segment with Dr. Califf where we talk a little bit more about relationships between academic health systems and cardiologists doing research, how they can collaborate effectively with digital health tech industry, and also how, from a policy perspective, we can accelerate the development and deployment of devices that help improve health. So thanks again, Dr. Califf, and folks, stay tuned for our next segment.
You bet. Good to be with you.